Their main focus at the moment is on the new hospitals, that being the country ones being built and Fiona Stanley and the like, and to structure things through private tenders when those get up and running. I don't think he realises the value of the commitment and the passion for the ones who are long-term workers within the public health arena. Money's the driver. It's always the driver. Especially when you're looking at privatising or tendering things out. You know, if he can save money and say to the public, we've saved money, but he doesn't tell you that services have depleted 20% or 30% or whatever the figure may be. He can just honestly stand there and say, we've saved you money. I've been through privatisation in 1995 when P&O came into my hospital, which is Sir Charles Gardner. Services dropped off extremely, not just markedly.
I'm really not impressed at all. I don't like what came out of his mouth totally. The big concern is the privatisation, because working in a public hospital, if they build our new hospitals, there's no guarantee we've got a safety of our jobs anymore, because they might say they're not going to redeploy, you go over as private or you don't have your job at all. I know at Swans the biggest thing was the cleaning of the hospital went down drastically, and you don't have the patient care like you should have. Well, if they get one in, they're going to go for the whole lot, aren't they? Standing together as much as we can and getting a campaign out to really hold our jobs and try and force the issue that they don't get privatisation through.
He was quite coy in what he said and rather non-committal, but I believe he has a privatisation agenda. I think it's a fait accompli that he intends to privatise at least large swathes of the public healthcare system, if not the entire system. Large swathes will be privatised. Very important that we organise members, delegates, and involve the community at large in television advertisements and also in leaflet drops. You can hand out leaflets and flyers to members of the public as they come into the hospital system, explain to them what's on the agenda. And we need to make it clear to these politicians that they are custodians of the healthcare system, they're not owners of it.
Standards will drop, and so will paying conditions, and you won't get contract cleaners cleaning as well as the in-house cleaners. I worked at Fremantle as a contractor, and you need to have the time to do these things. To clean properly, you have to clean rotationally, you can't clean everything properly every day, and standards plummet.